Medical and Wellness Center podcast. I am the presenter, Neil Haley, and I am excited about my guest today, Sarah Darr. She is with Reset Medical and Wellness Center, and she's the Director of Operations. Sarah, thanks for stopping by.
Thanks for having me, Neil.
All right, so let's kind of just dive deep into specifically how you learned about Reset and how that happened.
Sure. I've been a nurse for 26 years, and at my previous role, I worked pain management for 18 years, and my medical director at the time, Dr. Joshua Goldner, was one of our founders, and he asked if I would like to try something new and join and start up Reset. And that was 2 years ago this month, and I was like, absolutely, after I did a little research on it. So we had done the stellate ganglion block, or the neurosympathetic reset, if you will, within the pain management realm as well, but for different reasons. So after I did some research on how it could help folks with their PTSD, anxiety, depression, I thought this would be a very lucrative role for me. And I had experience with starting up clinics from my previous time, and thought this would be a good opportunity and I could help a lot of people.
Wow. Okay. And then you found out about it. So you knew about it before, but you never thought that this treatment could. So talk about the history you had with this, with NSR, which we call NSR now,
Yep.
compared to the other, and how it was used before, and then how the difference is. And that's why you saw this is a perfect fit for you.
Yeah. So in the pain management industry, the procedure is done for one pain diagnosis called CRPS. It's pretty rare. And so I was familiar with it from that standpoint and how the procedure itself worked and helping folks with their chronic pain issues. After doing research, after talking to Kelly Price and Dr. Goldner, and then after I met Dr. Lowers, I realized that this procedure had a lot more promise than I had known. So delving in to see how it helps reset and take you out of the fight or flight response to help you with traumas within your past, ranging from childhood up through adulthood, how it can help the military and first responders and regular folks like you and I. I thought this could really be a very rewarding way for me to help people as I'm ending my career. I'm probably within my last 10 years of nursing. I thought this would be a good way for me to retire out and really help the community. I have a soft spot for military and first responders, and this really appealed to me for those reasons.
Okay. Well, and it happened. So talk about the story once you got this together, learned about Reset, and how you have the ability to help grow these practices.
Sure. So when I was first brought on, I was told we've got 90 days to get this going. Really, I think we really started it in about 30. From the time I started till the day we opened the doors was about a 30-day timeline. So it was all hands on deck, let's go, with a very small team, but nothing I was unfamiliar with. Um, Throughout that process, we've developed relationships with a lot of nonprofit organizations that really fund this for military, the veterans, and first responders, which has been, I can't tell you this, I tell all of my patients, this is the most rewarding nursing job that I have ever had in my 26 years. And not to dismiss my previous jobs in my career, because those also meant a lot. But I had left patient care for 10 years to do administration. I was a VP of quality for 50 pain centers. And coming back into this role where I could help patients hands-on, in addition to doing some of the administration work, and get something like this up off the ground, really meant a lot to me, and for the community. And really, it's more than just the community of Cleveland, because folks fly in from all over the country for us to help.
And there's only a few people that do this, right, in the whole country. And what do you think sets you guys apart from them?
What I think sets us apart, and you're right, there are a handful of physicians that specialize in this procedure. Some delve into it within the pain world, but really specializing, there's only a handful. What sets us apart is our follow-up care, and the team that we've compiled, they're all in. They are here for the right reasons. We have a retired police officer. We have someone with medical background and office work, really coming from all different caveats of previous work experience, but everyone is here for the reason of helping people overcome whether it's PTSD, anxiety, depression, whatever they're going through. I've never met a team more engaged and involved and willing to go above and beyond and help. And then our aftercare that our patient engagement team provides. So we follow with our patients for a year. It starts with a phone call the day after your procedure to see how you're doing, and then we follow up within a week, and then at 30 days, and then it gradually spreads out 60, 90, and we send out assessments to get objective data. But what's really important to us is the subjective data that our patients provide to us on how they're feeling. And our engagement team does a fabulous job of gathering that and being an ear for our patients so that they have someone to talk to and they listen. They take the time to listen.
Because it's important to follow up. And did you have that? Who came up with that idea to stay so much in the journey of the follow up?
Yeah.
Yeah.
So the idea was developed by Kelly and Dr. Goldner, the founders, and then Dr. Lowers and the team here have carried that on and have held true to that as one of our founding points to keep this going and why we are different.
The importance of that difference. And what have you been blown away as a nurse seeing these success stories of people that have had the treatment?
Yeah, so the outcomes of the procedure itself. So I have various backgrounds in my nursing career from surgery, from community outreach and migrant camps to pain management. You don't see this type of positive results in the outcomes from patients in most of healthcare like we're seeing with the NSR procedure. So, for example, as a surgery nurse, you may see 50% of your patients get a positive result with some of the procedures and surgeries they're having done. We're seeing 75 to 80% of clinically significant improvement with the NSR procedure, which in healthcare is quite outstanding.
Wow, that's an amazing amount. And what do you think are the coolest things that you see the progress these patients make after the procedure?
So the results from our first responders and military, I would say, are the most profound. So a lot of those patients, based on what they've been through in their deployments or their rough calls as first responders, they really have some severe traumas that they've had to work through. And when you've been traumatized like that throughout your career, that can tend to portray some negative attributes towards your family, if you will. So you go home, you're quick to anger, you're quick to responses that you don't want to be. You're not the parent you want to be, you're not the spouse you want to be. What we hear in results back is I'm able to process this better. Something that triggered me in the past, I can take a step back, process it, and respond appropriately, not like I responded before the NSR treatment. And it's immediate for most people. They come in on day one, we do one side of the procedure. They come in the next day, had the best sleep of my life. I just feel much calm. I'm more relaxed. I'm processing better. And then at their week follow-up call, they're continuing to show improvement. I will say those who do the best with this treatment are those that follow through with the aftercare, that Dr. Lowers goes over a 5-step plan with them that supports healthy sleep habits, following up with your counselors, your mental health providers, whether it's meditation, equine therapy, whatever it is for you. It's that work after care too that will help you be the most successful after receiving the NSR treatment.
Yeah. I mean, that's why I am such a proponent of this. It's just unbelievable. And I think that so many more people need to know about this.
Mhm.
And especially when you're going through that mental health journey of trying everything, this is something you should definitely consider.
Absolutely. So a lot of patients come to us and they've tried oral medications, they've tried standard talk therapy, and a gamut of other things, and that's great, but this is maybe the stepping stone they needed to make those avenues work better for them.
Because it's the journey, it's just the beginning of the journey. That's why you
Correct.
have this outreach. You look at specific things, you look at for them to identify those changes because
Yeah.
it's hard sometimes to identify changes till you see other people around you observing you. That so it's such an important thing once you have this procedure to have people looking after you to see what changes, positive and that have really developed to help you get
Yeah.
through this.
Oftentimes it's their family and friends that notice the significant changes, even more before the patient notices. They notice the change in their behaviors.
That's great. And who do you think is the best candidate, especially now we're talking you as a nurse and
Mhm.
understanding this more once they come in to consider this treatment?
If you're open to and receptive to getting the treatment, I would say anybody that has something going on, whether it's anxiety, stress, depression, PTSD, we do it for long COVID to return of smell and taste, menopause for hot flashes and night sweats. If you are open to the treatment and the follow-up care, then it's right for you because I would say most of us have had something in our lives that have caused us some type of anxiety, depression, trauma at some point within our life. And while you may think you're okay, a lot of people aren't okay until they start talking about it. And a lot of folks, especially military and police officers, haven't started talking about it because there's still this stigma that it's not okay to talk about your mental health when it absolutely is
Right.
okay to
Yeah.
talk about your mental health.
And that's still what we're dealing with. Or you'd
Mhm.
have a line up for a waiting list for 6 months if we truly have these conversations about mental health, that we can see growth, we can see improvement. It's not our life sentence to feel this way the rest of our lives.
Absolutely. It's just hard getting people to understand and realize that and open up. And the more people that have had the treatment that will talk about their story, the better and the more we can spread the word.
So let's talk about the education piece.
Mhm.
When you're working with nonprofit organizations or other doctors in the whole United States, what do you think is the most important education they should know first about this NSR treatment?
Well, one of the most important things to understand is it's a very low risk procedure from a medical standpoint. Like anything, when you're puncturing the skin, there's a very low risk of infection. There's some other minor risks involved, but it's really no different than getting an IV start, honestly. There's
Mhm.
not much more risk to it than that. Um, so for the nonprofits, I think understanding the benefit and the outcome that the patients can receive, and the best way I think that we can get through to nonprofits or anyone, honestly, is our testimonials. Hearing the stories of our patients that have had it done and their outcomes and how well they're doing.
Okay. I think that's so important because when you're not able to have the this whole story, then you tell somebody this is the amazing progress and
Mhm.
it's been made. It's a game changer.
Absolutely.
Mm,
Absolutely.
okay. All right. What do you think your ultimate goal, especially, your position with Reset Medical, where do you want to see things?
I would love for us to have a full schedule every day of the week that we're open. So seeing 40 to 50 patients a week would be an ultimate goal for me. Uh, as we're getting started and spreading the word, we're growing. I would love to get to that level. The more
Uh,
we can treat and the more positive outcomes we can provide, the better.
Absolutely. And it's all about just getting that information out there and educating the public about it. So, where is the best place people can contact you guys if they're especially if they're interested in the treatment?
Yeah, so they can reach us at our website, which is www.theresetcenter.com, or our phone number, 1-877-RESET-10.
Okay. Thanks again, Sarah. Appreciate it.
Thank you.
That was the special simulcast of the Neil Haley Show and the Reset Medical and Wellness Center podcast, guys. Take care.